since Julie is a guest of the health plan, I'm going to take the introductions today. I don't normally get to do this part, but Julie is the CEO. Julie Brussow is the CEO of Security Health Plan, has been with the health system in various capacities for, I won't even say how long, but a long time, longer than I. Julie has worked in a lot of capacities as a director of operations. She was in sales. She's worked for the Marshfield Clinic fundraising, the foundation fundraising for us in the past. So has done just a tremendous effort in guiding the health plan these last several years. Has some really fun things to talk about today. So without further ado, I'm going to turn it over to you, Julie.
Thank you so much, Chris. And first of all, a big thank you to Chris, to Jeff, and to Ashley. We have a super team here at Security Health Plan and beyond within the Marshfield Clinic Health System. And as Chris mentioned, this is our 14th Wednesday webinar, and I have a big thank you to all of you. I know many of you are regular attendees to our webinar, and we just want to, again, thank you for taking the time. Thank you for your interest, and just to let you know, we appreciate you very much. Now, I am driving this thing, so I want to make sure I need to advance my slides. A little technical difficulty. There we go. My apologies for the delay. I want to start by just recapping. We all know what COVID-19 has done to impact all of us, really on a personal basis, on a local basis, statewide, national, even global basis. We have seen some, implications around Wisconsin and the nation experiencing, higher unemployment rates. When the pandemic struck in early March, employers had to make tough choices. Then there were public orders that came out that really required some of us to shut down or really reduce our business. And so we know that there was an impact from an unemployment rate, and really pre-COVID, we were seeing historic lows in unemployment. And now we're seeing that metric just shift so very quickly. We also recognized that some of the cascading and the downstream implications around having someone suspend business operations, that there would be a need for continued health insurance. And we would also have that need for continued health insurance costs. So those were some of the items that we all had to balance and juggle. If my business wasn't operating at full capacity, and we had to make some of the tough decisions around furloughing some staff. We also had to make those decisions regarding continuing health insurance coverage, because we knew that health insurance costs were going to continue to be required. But that posed yet another challenge around reduced revenues. Our operating revenues, in some cases, were going down, but that all of these things had to be managed and also coordinated. And we huddled together, and we wanted to make sure that we were doing the right thing for our employees, for our business constituents, etc. There also was the tough decision that was made from our care delivery colleagues, not only here at the Marshfield Clinic Health System, but beyond. At the beginning of the pandemic, many of the healthcare providers had to take a hard look regarding the suspension of some of the more non-acute or the elective types of procedures that were taking place. this was certainly done in a theme and an overarching view of safety for our patients, safety for our communities, but also we had to manage some of the really critical supplies that we needed to have in-house to take care of people, whether that was the PPE, the protective patient equipment, whether that was hospital beds as we planned for a potential surge. So we knew that fewer people were receiving care, but we also knew that we were working together to make sure that we had all of those necessary items that we would need in order to manage through the pandemic. Everything that we do at Security Health Plan is really anchored in our mission. Our mission is to enrich lives by helping consumers and communities reach their best health, by ensuring access to affordable and high quality health insurance. These are not just words on paper. This really is how we approach the work that we do each and every day to partner with you as the business community, but also to really execute and put our mission and bring it to life. Early in the pandemic, in about the March timeframe, we knew that our communities and some of our key business sponsors would need our help. First and foremost, I mentioned this, there was the abrupt shutdown that the pandemic caused. We could see that people were not only losing employment, but they were also losing access to some of these critical needs that they might have. In recognizing what we could do quickly, and this again was in the early April timeframe, our health system together with Security Health Plan really stepped up and tried to address some of the community needs. We announced $400,000 in community grants that were available. And so we asked people to submit a grant, a request to where we could potentially step up and help them through this challenging time. We're so proud to say that we had 70 charitable organizations from across the entire service area that we provide. And that really is that central and north central service area that we're in receipt of dollars from the Marshfield Clinic Health System and Security Health Plan. They were organizations such as our school district partners. We saw a significant need and requests that came in through our communities from food pantries, from our local YMCAs, from different family assistance programs. And so that was the first step forward that we reached out to the communities and really did offer some significant support early on in the pandemic. So what have we done since the early response? Well, all of you know that we had a multitude of changes and different state and federal level executive orders that came through. This is just going to give you a snapshot of the way that we have pivoted our organization and what we have done really to step up and support not only our current customers, but also broader in the communities. We've updated coverage for telehealth. We've updated coverage for testing and also treatment of COVID-19. I really want to give a shout out to the provider partners that really embraced some of the flexibilities that we could all enjoy through telehealth. Before the COVID pandemic struck, I'll give you an example. At the Marshfield Clinic, we had about 175 of our providers actively using telehealth services. We've been a pioneer in telehealth for decades now. There have been many conversations with our lawmakers regarding asking for improved flexibilities around reimbursement and coverage for telehealth. Well, the pandemic really pushed that across the finish line. Today, we have about 1,400 providers within the Marshfield Clinic Health System actively using telehealth, and that ramped up from 175 to over 1,400 in just a few weeks. And I'm told that by early July, the Marshfield Clinic has seen over 57,000 of our patients through telehealth services. So we wanted to make sure that security as a payer was keeping step with not only Marshfield, but all of the contracted providers that were offering the telehealth services. We knew that some of those elective procedures were shut down or were not available, but we also wanted to make sure we kept that connectivity with all of the patients of our health systems as well as the members of our plan. Next, we provided timely information, and we're still doing that today. We've had executive orders that have come out as early as Monday of this week. We have had numerous reports that we are still sharing, but we ramped up quickly on that front. We've proactively reached out to all of you. Like Chris and I both mentioned at the beginning of the presentation, this is our 14th week of having a session, a live webinar with all of you. We've increased the flexibility with our customers. We knew that there could potentially be some challenges by way of people paying premiums. And so we wanted to make sure that we were a good business partner, and we wanted to make sure that everything wasn't black and white, because we were really trying to navigate some uncharted territory. So we wanted to make sure that we were being flexible and doing that together with all of you. And then finally, we've provided support and services to help employers ensure a workplace safety. I know that Jeff and his team are leading the charge on this, but there is more to be done and more that we can do. So if any of you have any interest whatsoever, please reach out to us to hear about what the Marshfield Clinic Health System Business Health Services team are doing for many employers throughout the region and really beyond. Now I want to really get to the meat of my remarks today and share with you what we announced last week by way of financial support, not only to our employer groups, but also to our individual consumers. So we did take a look at doing more. Again, for us to have made a decision like this in the late March, April, or May timeframe, it really would have been premature. But now that we have seen that we're 5 months into the pandemic, we wanted to make sure that we evaluated this and really brought something that was meaningful forward to all of the employers that we're working with. So what we decided to do and what we've announced is that there is going to be a premium rebate for all of our fully insured employers. This is both large group and small group employers. We're refunding or rebating 10% of April's paid premium and also 5% of May's premium. That work is underway. You'll have your rebate checks in hand by September 1st. And this is something that is unprecedented within our organization. But again, in looking at not only what we see from a historical basis, but also that look forward basis, we know that this is something that we can do and that we can hopefully help ease some of that financial strain that COVID-19 has imposed on your business. Shifting to the individual and the consumer relief that's being offered. Because we do have products within both Medicare Advantage as well as the individual and family plans where there really is no premium. For us to offer a premium refund, really, there would be a large population of people that would see absolutely no benefit. So instead, the tactic that we took for the individual population was looking at waiving out-of-pocket costs between August 1st and December 31st for primary care visits, for specialty care office visits, and this would also certainly encompass telehealth visits. We know that whether it's a deductible or whether it's a co-payment or co-insurance, we thought that this would be our way of being able to pass along some sort of relief, as well as removing barriers for this population of people to get in if they have not been in, for instance, during that March, April, and May timeframe. And again, this went into effect on Saturday, August 1st, and will stay in effect through the end of this calendar year. Again, I'm going to refer back to delivering on our mission, reflecting on it, the earlier slide. Rebates, cost sharing, waivers, all of the things that we're doing around this topic really is in line with the stewardship and the partnerships that we have with our customers, our employer customers, our individual consumer customers, and all told, this combined effort is going to bring about $8 million in relief for Wisconsin businesses and families that are doing business today with Security Health Plan. It's the right thing to do. Again, we feel good about this decision, and we hope that this too will be something that you can take full advantage of going forward as you're working with Security Health Plan. Finally, I'm going to wrap up my remarks by putting an invitation out there to all of you to say and ask the question, what else can we do to help? I talked about our community benefit grants. I talked about refunds in premium dollars for our employer groups. I talked about waiving cost sharing for our individual consumers, both in Medicare Advantage, as well as our individual and family plans in the ACA market. I talked a little bit about what Business Health Solutions could do for all of your organizations by helping your employees not only return to work safely, but to be able to work through the next several months in a very safe manner. We have an endless supply of subject matter expertise and different individuals within our organization. I think you've gotten a flavor of that from the Wednesday webinars and the themes that Chris and Jeff have pulled together to really bring forward everything that Marshfield Clinic Health System has to offer. So if we can do more for you and with you, please don't hesitate to reach out to us. And with that, again, I'm going to extend a thank you and then turn it back over to Chris and or Ashley, who will help navigate the questions that are coming in and manage the chat box. Thank you.
Thanks, Julie. I have a question from your presentation, and I think you mentioned
Sorry, Jeff, you were kind of breaking up there. Can you repeat that question, please?
Thank you.
Sorry, I have, yeah, my internet out in the country isn't great. Can you hear me now?
Yes.
Okay. My question was, is there a place that we can go read more about this and what it means to me?
There is a place that you can connect onto our website, and the information and the communication is out there on the Security Health Plan website. So we certainly would welcome your connection on this website.
Okay, thank you.
And Julie, we have had a couple of questions from our audience. I'll paraphrase them a little bit, but the first one comes from one of our self-funded clients. And they understand that the benefits that you're talking about today are really geared towards our insured clients. But is there any benefit for them as a self-funded employer? They've had some ups and downs with us over the years. And we're just hoping that maybe they would be remembered in this.
Thank you. That's a great question. And first of all, I appreciate your participation and the confidence that you have in Security Health Plan. I have had self-funded clients that have reached out to me, and they have asked me this question. The part of the benefit from a self-funded perspective is that when the reduction in claims utilization from an insured side, those savings really do hit the balance sheet, if you will, from the health insurer, because the fully insured customers are paying a monthly premium. On the self-funded front, those savings should be accumulated really within your self-funded employee benefit account, if you will, by way of what your contract with us from an administrative services only perspective. We're not offering any reductions in the ASO fees. Our business has been maintained here at SHP, but you should be recognizing those savings from that late March, April, May timeframe from the reduced utilization.
Great. And then there's another question from one of our school district clients. So can we speak to what they should do with these credits that are really from 19 and 20, given that their fiscal year ended on 6/30 of 20?
Okay, I am going to recommend that, especially for those employers, we recognize that we are refunding paid premium. And depending on what the employer's contribution is for the employer premium, employers really should consult with their benefits subject matter experts, whether that's their benefits attorneys, whether that's perhaps tax counsel, but really to check with your benefits subject matter experts and the individuals giving you guidance around those plans regarding if you owe a portion of the refund or the rebate to your employees. We are encouraging everyone to make sure that you have looked at what this refund or rebate and how that will impact, especially if your employees are paying a portion of the premium. I know some employers are looking to offer a potential holiday, if you will, in cost sharing, in premium payments through the next payroll. So I'm going to refer you back to your benefits specialists.
Yeah, that's a good point. There are a number of ways to handle that. So that's really good advice, is to talk to your person that helps you with that. But certainly your attorneys can help with that as well. So yeah, unfortunately, there is a little bit of administration on the employer side to take advantage of this benefit, but it's still a nice benefit none the same. So we can work with you as well. I'll certainly encourage you to contact your account manager at Security Health Plan in the sales department, and they can help walk through some of those options with you specifically. One other question that came in. So you mentioned the waiver of co-payments and cost sharing for those individual plan members. Is that at any facility that they have access to, or is it just at Marshfield Clinic that waiver takes place?
That's a great clarifying question. Thank you to whoever asked that. The waiving of out-of-pocket costs for primary care and specialty care office visits, as well as telehealth, is applicable for the contracted network of providers. And so while it certainly is available if you're seeking care at the Marshfield Clinic Health System, we have a very broad contracted network that we have here within the Security Health Plan broad network. So it really would apply to the primary care, specialty care office visits, as well as the telehealth services within the network.
Great.
So Julie, what's the response been? I think you said that this was announced last week. What's the market's response been?
The market response has been very positive. We have had individuals contacting us with clarifying questions, but every time we have an opportunity to speak with a member, speak with one of our employer partners, we welcome that. I know that there was a clip on the WSAU news last night. I was interviewed by the news station, and so again, this has been received very positively, and we're just happy that we can do this and that we could really be able to offer this type of relief. I know that it may be small when you spread it out between so many different employer groups or so many different customers, but nonetheless, we're doing our part, and we know that it's the right thing to do. So if it helps in a small way and really shows you that we are committed to the overarching success of our communities, we're here for you. And that's why we would really like to hear more. What else should we be doing together, working together from that overarching healthcare umbrella perspective, both on the financing piece as well as the care delivery piece?
Excellent. You are going to be a tough act to follow up, Ms. Brussow. None of our other guests have come on the show and returned $8 million in the form of rebates.
Thank you. Are there any other questions coming in, Ashley or Chris or Jeff?
Yeah, we've got one that's just coming in. Let me just grab it here. Our school district has a high deductible health plan. We don't have any co-payments. What other benefits will our employees see in place of what others are given as a co-payment vacation? Well, as a high deductible health plan, they'd be insured, so they'll benefit that way. But Julie, more you want to add to that?
I'm sorry, Chris, you were cutting out.
I'm sorry. Let me repeat the question. So we have a school district that is has a high deductible health plan, so they don't have the co-payments in their plans. But what benefit will their employees see given the co-payment vacation? Well, they wouldn't take part in that part. They would get part in the premium side of it.
Yes, there are two different ways of that we were returning, if you will, benefit by way of from a financial perspective. The waiving of the cost sharing for the office visits is for our individual consumer customers in two buckets of products: the Medicare Advantage population, as well as those individual consumers who are participating in the ACA products, the Affordable Care Act products on the exchange. From an employer group perspective, the premium refund to the employers is where the benefit is going to go to. So there wouldn't be any cost sharing of, or excuse me, out of pocket, the waiving of out of pocket costs on any of the group products. It is coming back strictly in the premium paid in the April and May timeframe.
Great.
Thank you for asking that question. It's good to clarify.
Yeah, and we did have one other follow-up question that I'll just address here so that we can wrap up our conversation today. But does the employer have to reimburse the employees a portion of the rebate? If the employees are paying a portion of their health premium, then yes, the employer does have to return that. And as Julie had mentioned, there's different ways to do that. I'll just encourage you to work with your account manager here or your benefits consultant or benefits expert to walk through those different ideas. Jeff, I'll turn it over to you.
All right, thanks, Chris. And I'm going to double check that this is recorded because I think you complimented me at the beginning, and that's my new ringtone. So I'm going to talk to Ashley about that.
Well, I'm sure we can get that erased from the recording.
Julie Brussow, Chief Executive. Thank you for joining us today, and thanks for the great news. Thanks to everyone that joined us today. A reminder that our topics, well, this one didn't come from you. This actually came from the system, but the ideas for these webinars have come from you. So please keep the ideas coming. We'll keep the webinars going as long as you send us ideas that you want us to present on. We're happy to do it. And thanks very much for your time today.
Be well, everybody.
Thank you.